Hi, I'm Cheyenne, your nurse today. I'm going to be inspecting your head, ears, eyes, nose, throat for today. All right, we're going to start by checking your skin. So the color of your skin is pink, normal for ethnicity. The temperature of your skin is warm to touch, what we expect to find on the skin. Other than that, the texture is smooth, which is what we want to find. Moisture, there is no moisture on the skin. It is dry. There is no edema on the skin, which is normal finding. And turgor. All right, normal turgor, no tenting, again, normal findings. No visible signs of bruising on the skin, no visible signs of scarring. There is one nevi located over here, no other visible nevi on the skin. All right, now we're gonna be palpating a few things as well, if you don't mind, if I can just check for tenderness. All right. Do you feel any tenderness there?
Nope.
Very good. That's what we want to find. Normal findings there. Now we're going to be checking for your lymph nodes. If you could just let me know if you feel any tenderness. Irregular.
Nope.
Okay.
Nope. Nope. No. Nope. No. No.
Very good. And I don't feel any palpable lymph nodes either, which again is normal finding. So we're going to be testing a few other things for your face for today. We're going to be checking for cranial nerves. If we can go ahead and test for cranial nerve 5, if you can bite down for me. All right. Normal findings. It's symmetric when he bites down. And next I want you to go ahead and tell me when you feel any of this.
Feel that. Feel that. Yep, feel that.
Close your eyes.
Feel that. Yep. Yep. Yep.
All right, he feels them in all locations. That is normal findings. And we're gonna be checking for the movement of that cranial nerve too. If you can go ahead and smile for me, frown, raise your eyebrows, puff out your cheeks, and do a kissy face. All right, symmetrical movements are all normal findings of the cranial nerve. And that's cranial nerve 7, excuse me, for facial. And 5 is for the feeling of sensation as well as the TMJ for grinding. Other than that, we're going to be inspecting your ears for today. So I'm going to look at your ears for symmetry, shape, symmetric. Shape is normal both sides. Position is midline for the face on both sides. They're equal, which is what we want to find. That's normal. We're going to go ahead and palpate over the mastoid process. Do you feel any tenderness?
No.
I don't see any bulging or feel any bulging on either side. So that is normal findings. We don't want to find mastoiditis. Other than that, we're going to be checking a few things for your ears for today. So we're going to be doing a whisper test. If you can just repeat back to me with what I say.
8.
Normal, that's what I said.
8.
All right, the patient did verbalize what I said when I did the whisper test, so that is normal findings. Now we're going to be doing the Weber and Rene test. Do you hear that on both sides of your ears?
Yes.
Okay, and is it to more on one side versus the other? So
No.
Very good. All right, sound has stopped. Sound has stopped. So the air conduction is greater than the bone conduction, which is what we want to see in the Rene test. So that is normal. So now we're going to be checking your ear canals. So we don't see any wax buildup. We don't see any redness. The tympanic membrane is pale gray. The cone of light on his left ear is to the 7 o'clock, which is normal. And I don't see any swelling or edema. Again, same on this side, cone of light is to the 5 o'clock, no edema, redness. We see the same color, pale gray. Normal findings. Other than that, we are going to be looking for any other things like fluid, which we don't see any fluid buildup behind the ear. We don't see any perforation, holes in the ears. We don't see any edema, swelling. I didn't see any scarring in the ear, so that's all normal findings. So next we're going to be checking his eyes. We're going to be checking the eyebrows and eyelashes. Symmetric on both sides, no loss of hair on the eyebrows or the eyelashes. The fissures between the eyes are symmetrical, no issues there. Next, we're going to be checking for the color of the sclera, which is white, normal findings. Conjunctiva, pink. No drainage, no edema, no swelling in the eye, which is what we want to see. No redness either. So again, normal findings. So we're going to check for visual acuity tests. So you can just tell me, just say it says ABC. What does that say?
ABC.
What does that say?
ABC.
What does that say?
ABC.
We're a foot away from the patient. They do recognize all of the words down to the 20/20, so their vision is 20/20. They're not using any corrective lenses, no glasses, no contacts, so they have normal vision, which is what we want to find. Other than that, we're going to be checking for perla or cranial nerve 2. I'm sorry, yes, 2. So if we can go ahead and check your eyes with lights. Very good. So the pupils are equal, they're round, they're reactive to light, and they're accommodating. And they do constrict on both sides when we flash the light in one. Follow my finger. Okay. So again, normal findings, the pupils do constrict when we get closer to the face, which again is normal findings. So convergence and accommodation is normal with the patient. Other than that, we're going to be checking for other cranial nerves. So cranial nerve 3, if you can go ahead and just, which is what we did for perla, cranial nerve 3, that is normal. Cranial nerve 4, if you can look up, down, follow this, side to side, normal. 6, again, cranial nerve 2, 3, and 6 are normal findings for the patient, both symmetric, no issues there. So we're going to be checking for a few other things as well for today. So we're going to be checking the inside of the eye. So we're going to position the patient's same height as us if we can. We're going to go ahead and do the 15-degree angle to check on it. And we're going to dim the lights. And we're going to use our right eye to check the right eye. Very good. So we do see positive arteries in the area. We do see the red reflex. We see the optic disc. There's no swelling. There's no discoloration. The optic disc is circular, like what we want to see for the area. Next, we're going to be checking his nose. So looking at the patient, it is midline, it is straight. Have you had any surgeries on your nose before? Have you ever broken your nose before?
No.
Very good. That's conductive with the findings, all normal. Other than that, we're going to be checking the inside of the nose with our scope here. So normal. We see no redness. It is a light pink. We don't see any bogginess, no fluid coming from the area, no drainage. And the patient is able to breathe through his nose, which we're going to check. Breathe. Breathe. Very good. All right, and we're going to be checking the sensory test as well for scent. If you can close your eyes, tell me what this smells like.
Coffee.
All right, so that is normal findings for him. That's what we want to smell for that. Now we're going to be checking for the sinuses as well to make sure we palpate them and there's no sensitivity for the patients. And again, that was olfactory sense or cranial nerve 1. Do you feel any tenderness here?
No.
All right, frontal?
No.
Do you feel any tenderness in the maxillary? All right, so the sinuses there are normal as they should be. No tenderness, which is normal findings. Other than that, we're going to be checking the throat and the mouth. So we're going to be looking at the gums, the lips, the teeth, back of the throat, tongues. Go ahead and open your mouth. Smile. Checking the mucosa. Pink mucosa. Teeth are all intact. Normal findings. Stick your tongue out and say ah. Very good. All right, side to side test. And stick your tongue up. Underneath your tongue. Up. Very good. All normal findings. No issues. All pink. And the uvula is intact. We're going to be checking for the tonsil grade, which, again, we're going to use our light. Say ah. All right. Grade is 0 because this patient has had a tonsillectomy when he was younger, so there are no tonsils to be found. Other than that, the uvula is, go ahead and open your mouth. Midline, that is normal findings as well. So next we're going to be checking for any tenderness on the TMJ joint for the patients and any crepitus as well. Do you feel any tenderness here?
No.
Very good. I don't feel any crepitus, which is all normal findings for the patient. So we're going to be checking the soft palate, the hard palate, the uveal rise for a few of the cranial nerves as well in the back of the throat. The cranial nerve 9, stick your tongue out, say ah, rises as it should. Also, we're going to be checking for tongue movement, cranial nerve 12. If you can stick your tongue out again, move it up, side to side. Very good. All normal findings for that as well. So next we're going to be checking for his neck. Color is light pink, normal for ethnicity. The moisture is dry. There's no moisture. The temperature is warm to the touch. The texture is smooth other than the hair that we feel the roughness from. There is no edema in the neck to be present, normal finding. There is negative turgor or tenting, so that again is normal finding. I don't see any visible bruising, scars, or nevi on the patient's skin for their neck either, which can be normal findings. So we're going to be checking for his trachea. Okay, so move it side to side. Moves as it should, symmetric, no issues, no concerns. I'm going to be going behind you and checking your thyroid gland as well, if you don't mind. All right, I'm going to feel for the cricoid rings, go down from there. Go ahead and swallow for me. All right, normal findings, no nodules. My hands go up and down symmetrically, as they should as well. So next we're going to be checking for the carotid arteries. Just let me feel here. All right, pulsating. It's not bradycardia or tachycardia. Next, we're going to be listening to it as well. If you can take a deep breath in and out from the bell, and just hold your breath for me. Go ahead and breathe. Hold your breath. No sounds of bruises in the areas. I did not feel any thrills either, which is all normal findings for the carotid arteries. So next we're going to go ahead and check the range of motion for his neck. If you can move your head down, back, side to side like that, and then back and forth like this, okay? And then around both ways. All right, range of motion is intact, all normal findings. Last thing we're going to be checking is cranial nerve 11 on the shoulders. I'm going to put a little pressure here. If you can raise your shoulders for me. All right, he's able to move them up and down with no issues, and it is symmetric as well. All right, thank you so much for your time today. Let me know if you have any questions.